Dr. Lesmana, how do you assess the severity of autoimmune hepatitis in routine clinical practice?
Autoimmune hepatitis is quite a rare disease, yeah, in Indonesia. So not easy because we know that to assess the disease severity, usually we have to do it by the liver biopsy. But for most of people to undergo liver biopsy is one maybe big problem, yeah. So we assess the severity mostly through the non-invasive assessment such as like a fibroscan. But in the beginning usually we perform the liver biopsy, so for diagnosis, so we know for sure that the diagnosis is correct before we give treatment for the autoimmune hepatitis. But to monitor the follow-up, maybe the possibility of let's say like liver fibrosis improvement, and then so we do with through the non-invasive assessment.
What is the mechanism of autoimmune hepatitis?
I think it's still the same like mainly other liver disease, because it's also cause inflammation through the cytokines and I mean the process. But the one thing that we are still curious about the increasing the autoimmune hepatitis in our country, it's maybe because of the drug induced, yeah, mostly because
Would that be
genetically,
antibiotics, you mean?
yeah, maybe yeah, antibiotic or maybe some herbal supplements and other things. Maybe still possible because I know like India, China, Indonesia are three countries that quite often to use like herbal supplement
Sure.
in daily life, right? So that's why we're not sure why now it's a little bit increasing, but I still sure because genetically it's very rare disease for especially in Asian and South Asian countries, yeah. But now we don't know the exact number of the prevalence, but in my clinical practice it's increasing.
Can you talk about the progress of treatment for autoimmune hepatitis?
Until now, see, mainly treatment we still use a steroid base, even though that sometimes we combine with other immunosuppressant to have like maybe less possibility of the side effect of the steroid for the long term. And in our experience, the result is quite good, yeah. Even though that's maybe few patients that still progress to liver cirrhosis, but in our small study experience, we can show that even patient with liver cirrhosis due to the autoimmune disease, they tend to have improvement when they already diagnosed, even with decompensated liver cirrhosis, when we try to treat with a small dose of steroid. Yeah. So let's say like there was a ascites improvement, so less ascites and more decrease of bilirubin level, and yeah, even though it's very small number of patient in our small study, but still, I mean, it's a very good experience to show that even in patient with decompensated liver cirrhosis, it's still okay to use the just the base standard base treatment, I say like steroid. Yeah.
Ours is a Chinese journal,
Mhm.
Hepatology Digest. The Chinese cannot be here now for the
Yeah.
reasons that are obvious. What has the meeting done in order to try to accommodate those who cannot be here?
Yeah. At the first time, in fact, we are quite desperate because not only Chinese faculty, but some other countries also got problem from their government to come to travel to Indonesia,
Oh, really?
such as yeah, like South Korea and then Japan, yeah, but India. But finally, at the between I think maybe the last 2 weeks, we are very working hard to make the teleconference between countries. So let's say like today we already have a teleconference with Singapore, Japan, and India, and it's a two-way interaction, so it's very good. And I think during the main symposium there will be the one big session only for Chinese doctors. So they will do the teleconference presentation for most of the invited faculty during this main symposium.
Very good. Now,
Yeah.
Doctor, if you could address the Chinese hepatologists, what word of encouragement would you give to them?
I said first of all that I deeply regret about what happened in China, but secondly, because this is not only a China problem. I mean, at the end, we are all doctors, it's the same in society, and then we always meet together nowadays. So this is, in fact, is now everybody's problem. So I try to encourage them that don't give up just only for this kind of problem, because I think there are still so many other diseases that have a more severity than this kind of coronavirus. Yeah, I mean, let's say like even like Indonesia, the case fatality rate of dengue fever is still higher than this coronavirus. So for us, it's life. So we have to move on, whatever it is. Just do our job as usual, because like today, I was very surprised. Even like some faculty from Japan, Turkey, Philippines, I mean, even the United States and also from European countries. I mean, even not many, but they want to support this meeting. So, I mean, because we're friends, and then, I mean, we try to support each other, and we understand everybody condition, and really appreciate one to another, and try to accommodate everybody. That's all.
Very good. Thank you,
Okay.
sir.